Good morning, ma'am. I'm a student from Osmania Medical College and I'm doing my final year right now. I have a conflict between doing my PG either abroad or in India. So I want a clarification on this topic, ma'am. I want to know the pros and cons of doing my post-graduation in India and also the post-graduation in abroad.
Dr. Manisha, would you take this question? What are the pros and cons?
I will invite Dr. Mahendar to enlighten you about pros and cons of working outside India, or I'll talk in favor of my country, India. So Dr. Mahendar first, you go ahead.
Right. Wow, thank you, ma'am. But let me tell you, I mean, always it's for India only. It doesn't matter if Dr. Mahendar had been to the US or to the UK, and with extensive experience teaching and all that, I'm always for India. Having said that, there are certain advantages that you cannot ignore. Number one, the kind of medicine we are practicing is the Western medicine. Like it or not, that's a fact. So rather get it from the horse's mouth. See, why reading Harrison's and practice? You rather practice and then see what Harrison's is. The biggest difference between what we do here and what they do there, we read and practice, they practice and they write books. Those are the ones that we again read. That doesn't mean to say that our doctors are inferior or our doctors are not capable of it. They are, if not, better than most of the doctors that I came across, including the authors of some of the textbooks, right? Having said that, to come straight to your answer, there are certainly certain advantages that you have in the Western system of medicine, that be it the British system, be it the US system. My advice would be, if you have an opportunity, learn as much as you can from all different systems and then come back to India. You cannot ignore your motherland. This is our place and we have to be here, right? But there's nothing wrong in us gaining experience, exposure, and learning the better things. It's easier to learn the bad things, that comes in as a reflex. But to learn the better things, you have to learn, and that's a real layered learning curve. So my advice would be very straightforward. If you have an opportunity, if your family circumstances, your financial circumstances, and if your planning would permit, please go abroad for a few years, learn there, and come back, right? So coming to the straightaway differences between the postgraduate education, very specifics, it is a lot more structured in the US and UK. Say for example, I have seen some of the postgraduates here that work, definitely, but the direction of work is not very well defined. See, say for example, if you take the UK system, and again I'll come to that, a UK system and a US system. If you want to sit down, please sit down. We've got your question, right? Okay, coming to the UK system, again, it is a very patterned approach and there is a lot of emphasis on clinical medicine. Even today, with all the gadgets, high-end investigations, they still focus on history taking. Their benchmark exam is MRCP, the benchmark postgraduate exam. 50% of the marks are awarded for talking. Just for talking, right? 50%, that is history taking and communication skills. Then physical examination techniques and all are different. So the importance of history taking is still perceived better in the UK. So that is, I think, is going to be the major impacting factor when you are into practice. History taking, the more you learn and the more deeper you go into the medicine, you learn the importance of history taking. So that is number one. Very exacting history taking. And the case sheets that you write, when I've seen all the case sheets, general condition, GC fair, vitals stable, repeat 1 to 9. You will not get 1 month in England with that kind of case sheet writing. A very structured, formatted writing. So these are on-ground realities. You get a better way of teaching, learning, right? The disadvantage, if at all I have to say one, is the lack of volumes. This is where Indian system is way ahead, But again, what is the point if you are in an ocean, you can't drink the water? See, that also is another point. So I would rather say the MBBS level of exposure until now is perfect. If you can do your post-graduation in India is also perfect, but try and get at least for some specialty training or some extra exposure or doing some fellowships. There's nothing wrong, you know. Always you want to learn things that are better, right? Or the better parts of the things. I think I will stop here. Thank you.